Hello, today we're grateful to have with us on our podcast, Life Sciences and Biotech CEOs, Harry Glorikian. Harry currently serves as a general partner at a prominent venture capital firm focusing on the use of artificial intelligence in healthcare. Harry's life sciences experiences are broad and varied, and we'll get into some more of that later. But he's also been a frequent speaker at organizations like the NIH. He's a three-time author, including his new book called The Future You. Harry also has a podcast, and that's called Moneyball Medicine. Harry, you came to your appreciation for the potential benefits of smart data in kind of a fun and interesting way. And so I thought maybe we'd sort of start off with that. Maybe you can tell us about it.
So I actually, got exposed to the whole data space when, I worked for a gentleman who was building a computer corporation. So I was like learning how to build the PCs and, get them out there. But then at one point, we started talking and he said, he had made quite a bit of money, like being able to count cards, right? And the mathematics behind it and the whole nine yards. And then he actually showed me like the diagram, like there were people building shoes where you could input the cards with your toes, and then of course it would give you the answer with on your heel. And then ultimately I read a book that he had put together where they had built a wheelchair to actually figure out how to do this playing roulette. And you could just see how, if you had the right inputs, you could, with a high level of probability, predict what at least, directionally, how things were going to go on the table. And if you really got good at it, right, your wins were quite high, which was what happened to them when they tested it out the first time. And so, that was very early on, much younger, but it's been a recurring theme of data, analytics, prediction, constantly coming up as a theme throughout my life. And it's sort of playing itself out in healthcare and life sciences today. I mean, there's always a probability distribution, but depending on where you're going, your predictions get better and better over time.
Right. And then about a decade later, I think you're in your early 30s at the time, and you're working at a company called Applied Biosciences. And you're lucky enough to be there for the building of or the sequencing of the human genome for the first time.
Yeah,
Tell us about that experience, how it happened, what you learned from it, all that.
Yeah, I mean, in some ways, in some crazy sort of, opportunistic way, almost every company I've been at in my early career was, on the bleeding edge of something. Whether it was precision medicine and pathology, or when I worked at Applied Biosystems and we were, embarking on doing the genome. Phenomenal experience in a sense of smartest people you could be working with, really on the bleeding edge, sort of bucking what people said either you should be doing or you could be doing. Incredible heated discussions behind closed doors. And what I always love is the books that were written, they're not always accurate in what really happened in the room, but whatever, the books have already been written and out there. But you could see at some point, like this data, we're going to have to make sense of it. We're going to have to then put it into something that was translatable to the person who is going to utilize it or get value from it. We're still working on that today. And I think AI and machine learning are really making a difference in being able to translate that information to, a physician so that they can actually do something with this data that's being, communicated to them.
So before we really get into it, let's just talk about a couple of definitions here so that we make sure that the audience is on the same page. Um, how would you describe big data?
um, you know, big data. I guess big data is, you know, it's generally big data refers to large and complex data sets that are, I don't know, generated by, it could be, for our world, it's science, businesses, government, other organizations. These things can have different large, information, wide-ranging information from, and it was funny because I was just talking to one of our startups right before this call, customer transaction records, social media data, sensor data. Um, but it's, I think that big data, when we think about it, has the ability to transform all of these areas: healthcare, retail, finance. I mean, we're already seeing it in retail and finance. I think healthcare, we're lagging. But if you can understand it and probe that big data the right way, uh, you can really gain some valuable insights that can improve operations or help make better decisions.
Now, there are 4 iterations, if you will, I guess, of what we generally think of as data analytics: neural networks, machine learning, deep learning, that sort of thing. Can you maybe describe some of those differences for the audience?
Well, when I think about, like, if you think about I, if you think about Excel, right? I mean, that is the, when that came out, we were just talking about that yesterday at a brunch, right? WYSIWYG in Excel, like that was a huge leap forward. And ironically, what was it, yesterday? No, Saturday maybe. I actually saw a competition for Excel jockeys. Like, how people watch the gamers playing the game,
Right.
right?
Well, I
These
don't, but my
guys,
grandson does. So,
okay. So imagine your grandson now watching people do the same jockeying on Excel to win the prize or whatever, right? They're given certain things. And I was like, oh my God, where's the world gone? I mean, talk about analytics. But all these areas of, when we call artificial intelligence, I look at that as a big wrapper, sort of a catch-all name. I think it really depends on what function you're trying to do to understand which tool in the toolbox you're going to pull out. Is it going to be some form of machine learning? Is it going to be, a generative system that you need to basically train a system so that you can run simulations over and over and over again? So I think, to answer a question like that, you almost like have to try to get specific in what you're trying to do with the data that you have or the outcome you're looking for in the end. I think that's half the problem. Most people don't understand the nuances well enough to understand what they need to apply. I mean, I've even had to sit in with a bunch of experts and be like, what is the best way to solve this problem, right? And if you talk to 3 different experts, you might get 3 different answers, but at least you get closer to than a wild, throwing a dart and guessing per se.
let's talk about for a few minutes the ways that data analytics and artificial intelligence is impacting healthcare, let's say for the average person. In your book, you mentioned that you see artificial intelligence pushing healthcare to become it's the provision of healthcare to become more decentralized, but that the monitoring of someone's healthcare will become more centralized. And is that where you're going with sort of the whole Apple Watch thing?
Well, so if you look at how many different areas, and I think, I don't want to say it's almost happening daily, maybe weekly is a better descriptor of how these technologies are moving the ball forward when it comes to communicating information to the average person about their own health and wellness, right? And that's half the battle, is putting it into an understandable format. AI should be invisible to the average user. You shouldn't even think it's there. It's just sort of giving you the answer like magic. But whether it's accurately tracking your sleep, encouraging you to work out today, or actually discouraging you because you didn't have a good recovery, doing an ECG on you. If you have a certain, certain products are FDA cleared, that you can do a 6-parameter ECG on your heart, and then being able to use AI to identify aberrations or things that look wrong, that you should have your physician check, and then you can send that trace to your physician. Or, more complex things like ultrasounds being in, rural locations, and the AI actually saying, hey, move up, move down, move to the left, a little to the right, right? And producing an image that's equivalent to a trained ultrasound technician without needing any training at all. So you can see like the uses are incredibly broad, but fundamentally changing how healthcare is provided, maybe where it's provided, and how much better it can be because of the machine. The machine doesn't need sleep. It didn't play poker with its friends the night before. It didn't argue with its spouse. It does what it does over and over and over again, incredibly well. So it can produce consistent results. And the other part is in the background, it can be consistently learning. You don't want it to be updating all the time, but with certain updates, you can make it better and better.
Right. So we know about, again, monitoring sleep, glucose levels, those kinds of very sort of daily kinds of things that we might monitor. But are there one or two things that you think are especially exciting that maybe aren't even available yet, but are on the cusp of that availability?
I'll tell you, let me talk about one that's available today that I don't think people, here's the problem. Even though I talk about this stuff that's available today, and most people will tell me like, really? I didn't know that was like, so, and that goes for physicians as well as, the average person. But you mentioned, glucose monitoring, right? It's available, right? But is it hooked up to an app or a technology that every time you eat something and you input the food, the system can then correlate it to that food? And after the algorithm learns, after about 2 weeks, you don't need the CGM anymore. You just need to tell it what the food is, and it will automatically tell you what your glucose levels will be. So you can manage your whole, glucose levels much tighter. So if you're a diabetic, you're much more informed about which foods are going to do what ahead of time, right? And if you're a healthy person, you can actually keep that in a tighter range, A, sort of improving your performance and your mood and your energy levels, but B, potentially pushing off, being diabetic. And we have plenty of pre-diabetic people in the world.
Right.
But that's a technology that's evolving quite rapidly and becoming available to the average person.
So these kinds of retail products are exciting, interesting, all that sort of thing. But I think that the most important thing to me about AI in healthcare are the economics of it. And by the economics of it, I mean lowering the cost such that access is improved.
Well, all these technologies are becoming, so if you think about technology overall, it has a deflationary effect on, like, my iPhone does, I don't want to say everything, but boy, it does a lot, right? I don't need to carry around 5 different devices. It's my scanner, it's my phone, it does a million different things, right? And so if you look at where we're going with these devices in, say, I'll call it the digital health realm, but more and more is being added to the watch, right? More and more is being added to the phone. All of a sudden, there's a multitude of things that are monitoring me from a health and wellness perspective that if I catch something early and get ahead of it, I will not be chronically ill, right? So you ask me something that's just coming to market or has just come to market not that long ago. There's a blood test where you can do a simple blood test. You can do a sequencing test on it. You can see 50 plus cancers. There are no screening technologies available for those cancers today, right? So it's not like you're going to get that screening someplace else. You can find cancers at their earliest point. And as you know, we're incredibly good at treating those early on. We are horrible, or our cure rate later on is not as good, although we're getting better at it. But if you caught it early, yeah, you could really change the paradigm of people getting sick for cancer. Now that test is currently $949, I think, but that price is going to come down as the volume goes up, right? And as we get better and better, I mean, Illumina just announced their new machine that can do a whole genome at $200. That's going to have an impact on the cost of that test. If everybody in the US got that and we could catch cancer early, can you imagine what that would do to the entire dynamics of that, managing that disease?
Right.
And it's AI that's helping decipher that information, because it's not a human sitting back there looking at a chart, right?
Well, there are too many permutations for a human to even think about doing that if he had the ability, right?
Right.
So you talk about in your book as well the ability of AI to unlock the language of life. And I think you've alluded to some of it with your comments about genetics. That is the language of life. Can you maybe bring that to bear a little more strongly than I've been able to do?
Well, I mean, the more and more that we understand about the genomics, and genetics of individuals, the more we can gain insight into, diseases or different healthcare states. Now you need to monitor you should be looking at people over time because things change. But I don't know any area of biology right now where sequencing is not become a fundamental building block. And it wasn't that long ago when someone would say, why would you sequence anything? I remember that comment and I was like, huh? And now it's like, well, I'll sequence everything that I can, right? Possible. But if you think about, agriculture, material sciences, anything to do with animals, almost everything, we're looking at genomics as a base to make some fundamental decisions on going forward. And I think AI in making sense of all of that data is sort of fundamental. Where do I make that CRISPR change to cause that change? COVID, 48 hours to sequence COVID, 48 hours later, I've got the first mRNA designed to go forward. I mean, fundamental change going forward. Now, what you do after that is you still have to make it, you still have to test it, you still have to go through those processes. But even those, we're shortening all of them, right? I can do remote trials now. I can use digital twins to supplement my trials with the FDA. I can monitor people during the trial and after the trial. I mean, you're seeing a wholesale shift of how these technologies are causing a change in healthcare and life sciences. And we haven't even scratched the surface yet. I think the next 5 years is going to completely. I think the biggest impediment to change is people and the lack of fundamental understanding of the impact of some of these things and willing to take chances on them.
Yes. And people are an impediment. And I think the other impediment may be, and may account for some of their reticence, is that they don't yet understand how fast this is happening. I mean, what did it cost wasn't it $1 billion or something to sequence the first human genome? But now I think PacBio just came out with a machine that will do a long read for $200.
Yeah, I mean, Illumina came out with a machine just in the last month or two that, well, now it's not out yet. It's going to be out next year, but a $200 whole genome.
Right.
Right. And at some point you're like, okay, the actual sequencing is a rounding error. I need to do the analytics now. And even that is coming down in price. But the human brain has not been designed for exponential understanding. We sort of look for the next animal around the corner sort of thing, right? But when you look at the new chipsets or things like that are being released, they're not 25% better, right? They're like 10x better, 100x better, right? And so you're like, whoa, wait. I have to redo my calculations. I couldn't do this yesterday, but I can do it today. And so these are paradigm shifts sometimes in what it allows you to do. And I mean, I'm do my best to stay on top of this. And there are days where I'm like, oh my God, I didn't realize that was happening. And oh my God, the implications of that are profound. And so I'm trying to stay on top of it all the time. Imagine somebody who's not staying on top of it. You could have 3 generations go by and you might not even notice it.
I think it kind of lends itself to a yogiism, right? It's the faster it happens, the faster it happens, because of kind of the networking effect of all of this data and our ability to understand it and analyze it and apply it to different situations. And it's happening every day. There are, as you know, and maybe we can talk some more about this, ways in which AI is enabling us to combine CRISPR gene editing with CAR-T, which has been a difficult thing in terms of side effects and that sort of thing, but to make it allogenic. Sickle cell, liquid biopsy, which you've already mentioned, not just in terms of early diagnosis, as with the Grail thing, but also kind of making sure that it doesn't come back.
Therapy monitoring,
garden,
yeah. But see, here's the interesting thing. When you look at why did we do therapy monitoring? It's not that we couldn't see stuff early. It was because the system, the way it's designed today, couldn't fathom early detection right off the bat. You had to go to a physician and say, yeah, this person had cancer. We removed it. Can't see it. This is a good alternative to let you know whether the therapy is working or not. Okay. They're like, okay, I can wrap my mind around that. If you went to them and said, by the way, we can see stuff earlier than you can see it. No, how am I going to get paid for that? How do I manage that? It's not that the technology was incapable. It was the system was incapable of absorbing what the technology could do at the time. And you had to sort of fit it into the rubric to get the system to absorb it. And then the only way that Grail has gotten this far is they raised $1 billion and they sort of pushed it through, right? But you can see the inertia of the system itself sort of stands in the way of some of these changes, which is why I think some of the changes you're going to see are going to happen outside of the system or to the system.
Tell me about some of those changes you see.
Well, if you think about like, okay, I can go have a Grail test now. I can just order it.
Right.
Then I can go to my doctor. I don't necessarily need the doctor to order it for me. So distributed diagnostics is going to play a role there. I can monitor myself. I don't need to go to my physician, right? So there's another change there. Some of the other services now may start to be available at a clinic down the street as opposed to me going into the system, right? And so these are the changes that I think that are having a profound, can and will have a profound impact on the system itself. I can do remote monitoring. Do I really need the ivory tower to run a trial? So you see how all of a sudden these dynamics start to change. I think it has a profound impact on how and where things get done, which is, if you think about how we disrupted newspapers and other industries, it's not dissimilar. It's just slower in a sense of adoption because the decisions that we make have such a profound impact on someone's life.
Do you think that it drives us toward a value-based system as opposed to one in which, you know, physicians or healthcare entities are paid sort of for what they do?
I think the Affordable Care Act, and I know that people always have like this visceral reaction to that word, Affordable Care Act, but I would beg people read the document. There's a lot of really good stuff in there, like paying, you know, value-based payment systems that I think that has been driving the biggest change. And Medicare and Medicaid have been sort of the people that have been pushing that the fastest and farthest, and the private insurers will hopefully follow along. Those changes actually is what has caused digital health and all these technologies to be implemented, because you cannot have value-based medicine without objective measurement of outcomes.
All right.
Right? If I pay you for everything you do, I don't need to measure anything. If I pay you for outcomes, boy, you need to improve your process to get to that outcome. So it's changed how the adoption of technology within healthcare itself.
And what improves that outcome is, almost by definition, sort of a personalized approach to medicine, which is only enabled by AI.
Yes, but it's also optimizing process. It's understanding, you know, what works and what doesn't. I mean, we're already getting to the point where I think oncologists can't just prescribe whatever they want, right? You got to look at data. You got to pick, you know, the therapeutic that matches that, you know, signature the best. Now, if there is nothing, that's a different issue, but we're getting more and more to the point of the data is driving what you're going to do next. And you know, we have to do all the right studies to prove that that actually produces the best outcome. But I think we're getting there. And there are some hospitals like Geisinger that will give you a money back guarantee on surgery, right? Because they've optimized it to the point where, hell, we can offer the money back. We'll make a few errors along the way where we'll have to write somebody a check. But all in all, that's I would love surgery that has money back.
Right, sure.
So it's doable. It's just humans don't like doing that. So we sort of like create barriers and don't adopt it as readily as we could or should.
And as well, AI can reduce the cost of discovering and producing targets and drugs via things like selecting the right candidates in a trial, analyzing the data once the trial's complete, that sort of thing. Wasn't AI applied to the original Andelellum data, and where Biogen came back and said, well, if you look at things another way.
I don't know that particular example, but it wouldn't surprise me that somebody's also trying to look at the data, a number of different ways. Um, finding the nuggets within the data is always the issue. Now you hope that you produce something where you're not having to look for that needle in the haystack, but it's always good if you can find one when it's there. But I totally agree that the analytic processes that we're putting in place or that certain companies are deploying have sped up certain processes, whether it's discovery, identifying a new pathway. My God, it could be, the way that we were making that product, the AI is suggesting a completely different pathway for us to manufacture that product, which is more efficient and more cost effective, that the human being never learned in school. And so I'm waiting to see like one of these newer AI drug discovery companies, like sort of make it far enough along that they can produce a real calculation that says, here's really what it took us, to start having some benchmarks in the sand. Because the big guys, I'm having a hard time seeing them spend less. I think it's the newer, smaller entities that are identifying either drug pathways faster or targets faster, and then taking them the next steps, that will start to implement as much as they can to get to market as fast as they can.
So that's an interesting point you made. You said you had a hard time seeing the big guys using this to drive discovery. And yet I know that, Bristol Myers has done some work with Schroders. Pfizer, I think someone else. And then you have these little tiny companies, the Ginkgos of the world, the 23andMe's of the world, kind of working on things really at kind of the extreme. But the pharmas, you think, are less aggressive in this sense?
I mean, there's a lot of partnerships that are going on, right? Trying to change your internal process is not trivial. And I know, because of some of the stuff we're working on, what would have taken me 50 to 100 people and I don't know how much money, I'm now doing with like 3. Well, if you got 50 to 100 people and I'm telling you can do it with 3, that is not a palatable or easy decision to make, right? And nobody makes that quickly. So that takes time. In the meantime, these smaller companies are sort of moving very quickly along the path. What I think is going to be interesting is, will any of these little companies, become the giant and take the place of, right?
Well,
because what everybody doesn't always appreciate is, once the flywheel is working, it just keeps producing. Mm-hmm. Yeah. It's not like I serendipitously found this one molecule. It's an engine. Right. And so I think we're probably 5 years away from that, but that's not a long, it's not a long time.
No, it's not a long time. And already, of course, via COVID, a couple of those little tiny companies have become major companies. And there, I'm, of course, speaking of Moderna and BioNTech, which were, I think, under $1 billion before COVID.
Well under $1 billion, pre-COVID. Yeah. But you think about it, is if you went along the entire value chain of producing a drug, and you said, where can I start to implement these changes? And you did it everywhere. You can really move the needle, I think, from a time and cost perspective. Now, the first time you do it, maybe not, because there's just inefficiencies. But you get 2 or 3 turns of this, and you really start to see where you can implement, digital twins, remote monitoring, data analytics on your, post data and pre-data. You can really move the needle from discovery to who am I going to give that drug to, that I think completely changes the paradigm of what exists today, to the point where if I can actually monitor at the end, can I adjudicate whether the drug is working or not?
So let's talk about, again, kind of extend this into the future and talk. What does the hospital of the future look like to you? Have you thought about it? And not 5 years from now, but maybe 10 to 20.
I think I think if we do this right, we will have a much larger preventative portion of the system rise up, where you can see a problem much earlier and intervene. It's going to have to be behavioral changes, but it's not just going to be like, here's your script, go fill your script, right? Sort of thing. And I think that will sort of decrease the volume that comes through the system itself. Or that would be that's what I'd like to see happen. I think that we will understand diseases much more specifically and have specific therapies that will hit a particular subtype of what we may call a larger disease area. And that's been happening over time, if you use breast cancer as an example. And the insight that we're going to get from everything from images to everything else is going to just go to another degree, where our accuracy of diagnosis, and therefore, as a result of that treatment, is just going to increase over time. And it's not going to be everything, because there's always that long tail. But in the major areas, I think we can cause a massive movement. Like I said, the biggest impediment is the adoption of the individuals in the system itself. And then getting the policymakers to even understand what I just said. Because if we move the needle on that from an economic perspective, it is huge for every economy out there.
Yeah.
And so trying to make that connection, I mean, how they don't even know the difference between Facebook and Google. How are they going to understand what I'm saying?
Right.
But it's so fundamentally important to the country that if they just made a few policy changes, you really could move the needle.
Exactly. Yeah. I mean, it's 17, 18% of GDP is healthcare. If you can cut the cost by 20, 30%, that's a big number.
Oh, you can do
somehow
that.
The 29 trillion that we owe isn't so important.
Well, the funny thing is you could cut some of that without the AI, blah, blah, blah.
Yeah,
right
of
now.
course, yes.
But that said, imagine if everybody was just healthier longer. You as a country are spending less, but that person is much more economically productive. Like, it's a no-brainer. But trying to get people to, like I said, understand the implications of this, or I don't think they're spending enough time on it to understand it.
And the other thing that I think about is how the role of physicians and nurses, healthcare workers, will change, and our need for them.
I think the need is not going to go away. So the human is going to, I mean, if the machine says, well, you have cancer, like, I'm not a happy camper, right?
Right.
I want to have somebody talk to me about that,
Yes.
right? I also want to make sure that somebody qualified is looking at it and saying, yes, I agree with this, right? Now, in certain situations, either the light is green or the light is red, and it's going to be obvious. But you, that human touch, I don't think is going to go away anytime soon. I think that will take a massive cultural shift for that to happen. But I just don't see, I see like remote patient monitoring allow a physician to manage a much larger, group of patients much more efficiently, keep them in the zone better, right? And actually generate the revenue for themselves because they're able to do that. And so both groups are happy. They're healthier, and this person is actually getting paid what they should get paid.
Right.
So I see technology being implemented the right way as a win-win.
So we've talked about some of the impediments to this realization, whether it's pay fors, whatever it happens to be. The thing we haven't talked about yet, and may well be, certainly is an impediment as well, are the ethical issues. The Chinese doctor who made a baby was just released, I understand, from prison. But what do you see as the ethical concerns, and how can we understand them and overcome them?
Man, that's a loaded question. So ethics, there are things that if you look at humanity over time, that we change our position on things as time moves on, and what wasn't acceptable yesterday becomes acceptable today. I do believe that there's a number of moratoriums on there that we're not going to do certain things. And those are really good. Like, we don't want chemical weapons, we don't want biological weapons. It's good to have those moratoriums. There are probably, certain places in the world where they are tinkering. But I think one of the things that should stop people is, like, when you want to make some of these changes, they're not trivial changes. I mean, right now we're only making like a single letter change in, say, sickle cell. We're not doing multiple genes, and right, we don't know what happens, right, when we do those things yet. We're not that smart yet. But I believe these are things that, again, if the policymakers are not having an understanding, they're not going to be able to put the right laws and put the right protections in place. That I still think they're just fundamental things. Like, if you get gene sequence now, it doesn't stop a life insurance company from not, they can say, we're not covering you because you have this, that's a simple change, right? That you could see we should have in place that would protect that individual. But from an ethics perspective, I think there's got to be a lot of debates, a lot of meetings, a lot of discussions, and then being able to get the people that are in power, wherever they are in the world, the understanding that they need, that these are the things that are happening. And what I always tell policymakers is try and get ahead of the curve, because you're already behind. And you don't understand how quickly things are moving. So you're even farther behind than you think you're behind.
And I'm surprised that the success of the vaccine companies in COVID hasn't sort of forced that dialogue. Instead, it's tightened everyone's position and made them less open-minded to what's happening.
Well, I was hoping that this whole dynamic that happened with vaccines would get everybody to go, let's revisit this process. Where can we make some adjustments? Now, I'm not saying go full hog in one direction, but let's reevaluate. And that may be happening at the FDA level, and I'm just not aware of it. But I think it's an opportunity that you need to take advantage of.
Yeah, I would say that Congress should be involved. There should be committee hearings and that sort of thing, and I they need to learn in some way.
I hate saying it, but I think most of them are too busy mudslinging
Yeah,
to take the time to understand how this will fundamentally impact every future generation.
right. But and we've talked about this, the opportunity to alter economies with this and provide, therefore, extra dollars for other pet projects, climate change or feeding the world or whatever it happens to be. Just pick one. The dollars can be there, but you have to.
Oh, I think any major economy in the world that doesn't have some of these fundamental R&D capabilities is uh, you at some point you're out of the game, right? Um, you know, what if I can manipulate the genes in this yeast cell that can produce a component that I can then harvest for this process, and I don't need to cut down that tree anymore.
Right.
I don't need to come to your country and cut down these trees anymore, right? I mean, there are some fundamental changes that are happening that if you're out of the game, you're out. You're getting back in, it will be too late because everybody always says, well, name another Google other than China, right? Because they have a closed system, but name another Google. Doesn't exist. Try and catch up to Google. Good luck.
Yeah.
Right? And that is going to happen in some of these other areas that we're talking about.
So, and then maybe we'll end on this. Harry, tell me if you've thought about name another Google, name the next Google that we're not thinking about in healthcare. And don't say Moderna.
No. Moderna is very specific. I don't know who the next one is going to be. I know that there's a number of entities that are trying to aggregate the data. The biggest issue is the data is not as the interoperability or making sense of the data or having the data in the right format is not like on my show, like that is a recurring theme that keeps coming up is, interoperability and can I do anything with this data or do I have to clean it up? But I think if you look at somebody like Apple or somebody like Amazon on the healthcare side, I think there's a lack of appreciation or the amount of data that they're generating and what they can get from that data and then do with that data that they can then build off of. And it's sort of like, when you put the frog in the water and you're slowly turning up the heat, like in the end, you still end up getting boiled. And this is the same thing. You're just not seeing how much data they have already that they can be like, well, what if we could do, let's look at this and let's look at that, right? I think those are the entities that you need to keep at the top of your mind of being the next healthcare player, as opposed to some drug discovery company that's going to, quote, be the next player.
Interesting. I saw today that both Google and Amazon have altered in some way the infrastructure of their cloud offering to life sciences companies to make it easier and more broadly applicable. And perhaps that's sort of moving in that direction.
The data that we're getting off of an individual right now is massive. I think I have like a Whoop here on my desk, and this does between 50 and 100 megabytes off me a day.
Wow.
I mean, what study do you want to run? Right? They just published this great study on pregnant women, right, that they were monitoring. Or another one was, and I just know this because I was talking to their chief data officer, a study on menstruation, and it's how it affects training for high level athletes. Do you train? Do you not train? All the rest of that. You couldn't do that with 30 people, right? You're doing that with
30,000.
hundreds of thousands,
Yeah.
right? It's like from a data perspective, you're a kid in a candy shop. Same thing with Grail. I just actually interviewed the chief medical officer of Grail for my show. He's like, we went out and did this. We're doing this big study in the UK, 140,000 participants.
Wow.
It's not like, oh, let me get my statistical count. It's 140,000. I can do a lot with that. We're underestimating the impact of these technologies on what we can see, what it shows us, and what we can do in the future.
Interesting. Yes, I know that Robert Greene at Harvard is attempting to put together a project to completely sequence 50,000 babies. Of course, babies are sequenced, but only for very specific situations in different states. He wants to completely sequence 50,000 babies and follow them through their lives, and what that will mean in terms of our ability to compound, in a sense, data.
Yeah, I mean, Robert's a good friend, so I keep track of everything they do over there. Actually, I cover BabySeq in the book. But you can imagine that the lower the cost of sequencing and the lower of cost of compute now allows you to do much, much more, right? Again, these, I don't want to call them rounding errors, because if you're doing 50,000, it adds up. But compared to what it used to cost, now it becomes totally doable.
Right.
And if you can go in and affect that child today so that they don't have a problem later, the economic impact of the system is profound, let alone the child's life.
Right. Well, it's been a fascinating conversation, Harry. I really enjoyed it, and I hope that it helps to shed some light on what's happening in terms of data analytics, but also how fast it's happening and the broader impacts that it may have on our economy as well as our healthcare. So thank you very much for your time, and I look forward to speaking with you again. Thank you.
Thank you so much for having me on the show.